Today is about recognizing the gift that home health care workers and care workers give to us as a society.
Vice President Kamala Harris announced the Biden administration has finalized the first ever minimum staffing requirements for nursing homes.
It's about helping people get dressed in the clothing that makes them comfortable and doesn't irritate them.
The move comes after the COVID-19 pandemic, which saw advocates for the elderly reporting poor living conditions for residents. Some went hours without meals and water and were not kept properly clean.
It's the kind of care that really comes from a very special place of humanity.
The pandemic claimed the lives of 167,000 nursing home residents, and afterward, there was a dramatic drop in staffing.
These are our family members, our second family. I care about my residents, and when I'm not at work, I worry about them just like if I was at work.
The rule will require all Medicaid and Medicare-funded facilities to provide a total of at least 3.48 hours of care per resident each day. This means a facility with 100 residents would need at least 2 or 3 registered nurses, 10 or 11 aides, and 2 additional nursing staff per shift. The rule, proposed back in September, looks to address unsafe care practices found in understaffed nursing homes.
Home care companies were not required to report how their federal dollars were being spent.
Right.
Now, we are requiring that 80% of that money be spent on paying workers as opposed to administrative overhead.
The goal is to also ensure workers aren't stretched too thin. However, nursing home operators say they're already struggling to fill positions. There's a fear the mandate could cause facilities to close. The mandate did not require congressional approval, but a bipartisan Senate bill would prohibit the Department of Health and Human Services from finalizing the rule.